Hello, everyone, and thank you for joining today's educational webinar with Cancer Support Community Los Angeles and the Adolescent and Young Adult Program at USC. I'm Kathy Riley, the Associate Director of Programs at CSCLA, and I'm so honored to welcome you to this webinar titled Conversing with Your Healthcare Team for Adolescents and Young Adults. Before we begin, if this is your first time joining us, Cancer Support Community Los Angeles is a premier nonprofit organization that provides vital social and emotional support to families facing cancer. And that includes patients and caregivers and their loved ones, all at no cost. And our programs include support groups, healthy lifestyle classes, social activities, and educational programs like this one. So if you would like to learn more about our services or watch past webinars, you can visit our website at cancersupportla.org. In 2013, USC's Adolescent and Young Adult program was established at the Norris Comprehensive Cancer Center to meet the unique developmental, social, and emotional challenges of young people with cancer, ages 18 to 39. And their interdisciplinary team provides vital age-related clinical services such as counseling, support groups, insurance and financial concerns, and fertility preservation for adolescents and young adults at Norris. And in addition to these critical clinical services that they offer, they provide supportive care programs that welcome young adults and their caregivers from any treatment center. The program's goal is to provide opportunities to educate through workshops like this one, find avenues to express oneself through art, journaling, and others, encourage health promotion topics such as oral health and pain management, counteract isolation through connections such as social activities, and establish a strong support community for young adults and survivors through signature programs such as the 3-day retreat. And to learn more about the AYA program at USC, you can visit their website at aya.usc.edu. So I am about to hand things over to our moderator and panelists, but before I do, please note that your video and microphone are automatically disabled for today's webinar. We really encourage you to enter your questions, however, into the Q&A feature that you'll find at the bottom of the Zoom window, and enter those questions at any time. Questions will be answered during the panel discussion, and we may not be able to get to all your questions today, but we will get to as many as possible. Now I'll introduce our moderator. Aura Kuperberg is the project administrator for the Adolescent and Young Adult program at USC, and she brings so much passion and insight and wisdom to the AYA at USC-based group-based programs addressing the psychosocial needs of adolescents and young adults with cancer. And it was early in her career while doing her social work internship at Children's Hospital Los Angeles in 1979 when she first dreamed of establishing support programs for these vulnerable young people. She earned a PhD and dual master's degree from USC. And Aura, welcome. It's such a great pleasure to have you here. I know we've known each other for many years, and it's wonderful to be partnering together for this webinar. So I will hand things off to you, and welcome to our panelists. Please feel free to turn your cameras on, and I will come back at the end of the session, and I'll hand things over to all of our experts today. So thank you all for being here.
Thank you so much, Kathy. That was lovely. Thanks for the welcome, and welcome everyone out there. Thank you. And certainly welcome and thank you to our panelists. We're so appreciative that you're here today. And that you can lend such different experience and perspectives in regard to communicating and conversing with your healthcare team about cancer. We are delighted to have with us this afternoon, first, Dr. Gino In. And by the way, in a few minutes, I'm going to give you time to introduce yourself. a medical oncologist at USC Norris Comprehensive Cancer Center, Liesl Schweers, who is the lead clinical social worker for the Life Cancer Survivorship and Transition Service at Children's Hospital Los Angeles. Welcome, Liesl. Jonathan Summers, certified patient advocate and 12-year survivor, among many other things, and Victoria Vargas, caregiver, and I think substitute teacher, but we'll get to hear. Okay, great. Now I'm going to give Victoria the initial moment to introduce herself and to tell her story as a perspective of a caregiver. Thanks, Victoria.
Thank you, Awar. So I think the slides, I don't know if they're actually going to pop up now, but
yes,
as Awar said, my name is Victoria. I'm an aspiring teacher. I like to say that I'm a fiance first and then a caretaker. I feel like caretaker kind of almost took over my entire identity when we first initially got diagnosed. So as you can see, I recently did a half marathon, and then that's my best friend. And then me and Mars like to occasionally go to concerts and raves. That was us at Millennium. So next slide. So our story is we unfortunately got diagnosed about 3-ish years ago. We're going to have our 4-year anniversary in July, which is kind of crazy because it's our 4-year anniversary that we've been together, and then that he got diagnosed with synovial sarcoma, which is a pretty aggressive cancer. Next slide. So our life mostly revolves around dogs, and we like to go on adventures. And he recently proposed in Sedona. So that bottom left picture is me and him. And over the years, at first, when we got diagnosed, like I said, it almost took over my identity. And then his mom actually stepped up. So if you can go to the last slide really quick. His mom really stepped up, and I feel like because she stepped up and she stepped in and she took over so much, we were able to have a relationship. And I truly believe if she was not there, we probably wouldn't even be together. We wouldn't be able to have a relationship. I would have given up all of the things that make me, running, dogs, working out, teaching. Right now, I'm actually almost done. I just have 2 more tests, and then I can start clearing my credential and getting back in the classroom. This past year, I was subbing for high school, and I think high school is more of my jam because I'm pretty chill. The little ones, I really like 2nd grade, and then I like 4th grade. So we'll see, fingers crossed. And that little dog right there, that is Snowflake. I just love that picture so much. And that is pretty much my story. So thank you guys so much.
Thank you, Victoria. And you really make a great point of that a caregiver, there doesn't have to be just one. Your family really helps. So it's not a caregiver, they are caregivers, and that's great. Thank you. Let me just mention, Dr. In, I'm going to have you at the end, but I wanted to mention, which I didn't see you before, is that we're just doing introduction, just who you are. That's it. Not, and then we're going to go into the questions after. So next, I want Liesl Schweers, please, to introduce you as the clinical social worker and someone who's been in the field for many, many years and have worked with survivors. So go ahead, Liesl. Thank you.
Thanks, Ara, and thanks to Kathy. Really, really delighted to be here with all of you today. As Ara mentioned, I'm a licensed clinical social worker. I am the primary psychosocial team member for our long-term follow-up clinic here at Children's. We provide surveillance for the ongoing late effects of cancer treatment for children, adolescents, and young adults. We have a very robust program. Our team includes a physician, nurse practitioners. We consult with dietitians, occupational therapists. And really, our whole aim is to help young people prepare to be good self-advocates. And when we think about communication, we think about how can I get across my needs, my wants, my concerns, to make sure that I'm getting the care I need and I'm getting what I need out of life. So I think that, you know, the self-advocacy and the support we try to provide to enhance communication is something that's woven throughout everyone's, it's everyone's job, it's everyone's responsibility to show up, be present, and acknowledge the history that the family has journeyed, and then helping this young person to launch, to become confident in the ability to get the care they need to live a long and healthy life. So really excited to be here to talk about this topic today. Thank you.
Thanks so much, Liesl. And next, I want to welcome Jonathan Summers. Jonathan is a certified patient advocate and a 12-year survivor and many other things, and a great friend to AYA. So thank you, Jonathan. Go ahead.
Oh, thank you, Aura. It's great to be here. And thank you, Kathy, and the cancer support community for putting this on. And thank you for being in attendance, because without you, we would just be talking to ourselves, and that's not fun. Yeah, I'm a board certified patient advocate. I'm a 12-year testicular cancer survivor. I was treated in Los Angeles. I'm a writer by trade. I write TV shows and movies, and after treatment, I found that I was more compelled to help others. I like to say it's how I find meaning in a diagnosis that felt meaningless at the time. As you'll hear, often AYAs felt very alone. And when I found this community, I knew I wasn't. So I started creating content and concurrently mentoring recently diagnosed patients. That led to realizing that in the LA school systems, we weren't teaching about the importance of early detection for testicular cancer. I worked with USC and UCLA, and we launched a program to reform the LA health curriculum. And then I started to continue to create content in the cancer space specifically. And I realized how this platform could be used to help doctors and clinicians to really use it to say their message. I became involved with a division of the National Cancer Institute called SWOG, which are publicly funded clinical trials. Your taxpayer dollars pays for it. USC is one of the SWOG sites. I serve on their patient advocate committee, digital engagement committee, as well as adolescent young adult cancer committee. I've had some research with them involved how those videos could be used to engage with public about cancer trials. I recently received an award to now look at the plain language summary of cancer trials, and then is it effective as videos? And hopefully we'll now be using video plain language summaries for patients to engage with research. I'm a board certified patient advocate. I own my own business called Cocoon Patient Advocates, where I help people navigate the healthcare system. And I consider it a great honor to work with patients daily to help them along their health care journey. Thank you.
Thank you, Jonathan. Thank you so much. And Dr. Gino In, like I said, was a medical oncologist at USC Norris Comprehensive Cancer Center. Let's hear, I'd love to hear all the things you do, Dr. In, which you do, and you're a great supporter of AYA. Thank you.
Hi, Aura, and thanks everybody for having me here. Yes, I'm a medical oncologist by training. I specialize in treating patients who have skin cancers, particularly melanoma. And this is a bit unique in that this is a type of cancer which affects patients across the entire age spectrum. So in addition to our cancer patients being 60 years and older, we also have patients who are as young as their 20s, 30s, and 40s as well. And so a big part of what I do is engaging with this younger AYA patient population, and that can be complex because it's already hard enough for us to treat the cancer and focus on the medical aspects, but we know that this particular group may have other things which can factor really into their well-being as a whole. And so I think having a team that includes Aura and the rest of our team here at USC is really critical to that. It's truly multidisciplinary, and it really requires a village for us to help these folks. So I think we've learned a lot over the years about things which work and which don't work, and it's been a great experience, but certainly one which I think we still have a lot to learn about. And so I'm glad to be here.
Great. Well, thank you, Dr. In, so much, and thank you the whole panel. So we are going to start with a question. These are very general questions, so feel free to kind of, if it's if there's a seed that's planted, you think of something that's related, please feel free to add it. But I was just going to start with a general question, because I think when I speak with some people, I really understand how navigating the medical system can be overwhelming and confusing. I think that was maybe brought up last week in our first meeting. And are there any suggestions from your point of view and how one can prepare to have better and more productive communication about that, to alleviate some of that confusion? That's a very broad question. So I just thought I'd throw that out. And just the follow-up, are there strategies maybe to help map and communicate or navigate through this experience? Are there actual strategies? And maybe I even I'm going to point out Victoria, because and also Jonathan, maybe from a more personal point of view, especially for Victoria right now going through it, did you find the system confusing at times? And how did what helped you to communicate, or what could you have found more helpful in navigating?
Yeah, definitely. It was definitely confusing at first, but after, kind of battling it for about 3.5 years, we found multiple things that have helped us. One thing that I would love for everybody to know is to not be ashamed and apply for all of those resources that you can get. We have something called, so if you have a pen and pencil, at-home support services. You can get a worker to come and help you clean and cook and whatever it is you need. Take advantage of the EBT food stamps, and just do what you can with that. Really communicate with your closer family members, because it depends on who wants to help and who can't, and that's okay. And I feel like we've gotten questions as far as like, let us know if you need anything. But for the most part, it is a little overwhelming to navigate all these tasks. So for the most part, I would recommend just telling them, just show up, just come. I remember there was this one time where we were at home and he was recovering and his cousin just came over. She's like, hey, I'm coming over. I'm bringing fish. And she just came over and we hung out and we had fish for dinner and it was really nice. So she really just showed up. And that's the best thing that you can really do. It was a little confusing at first because we didn't really know the language. And I thought that it was really empowering for Mars to really step up and kind of go into the research, even though it can be a little scary. You really want to know what you're getting into and you want to empower yourself and get yourself a little familiar with the language so you can communicate with everybody a lot better. As far as his mom is amazing. And we really just teamed up and we communicated. We'd say like, oh, he's had this. He hasn't had a juice. He hasn't had a happy tummy. It's like a remedy that she has. She has all of these at-home remedies that she makes on her own. So if you're also able to kind of like look into superfruits to help with the stomach and keep your system going, try to eat as healthy as possible. I know it's really, really, really hard because I'm a notorious cookie eater. So just do what you can with that. And as far as like strategies, definitely have open communication, not only with if your partner was diagnosed or if your caretaker is there, just let them know exactly what it is you need and empower yourself with the language, get to know what your diagnosis is, get to know how you can navigate your your medical insurance. At first, I thought like when I was watching him communicate, it was very interesting because he would get the paperwork and he would read through it and then he would kind of navigate through there. So I really just recommend everybody to hopefully, get familiar with the language, apply as much as you can, and just let people know, just show up, just do it.
That's great. Thank you. From any other perspective, I know that's hard because you're sitting in a different seat everybody else, but I'm sure people come to you and tell you things are confusing, or I'm just wondering, Jonathan, I'm going to pick you out.
Sure, I'm happy to.
Because I'm just thinking, well, I'm also thinking of a story you told me when you were first diagnosed. But you said, no, your doctor really helped you navigate, I think, if I remember.
Yeah. So with me, I was diagnosed on a Thursday, seen at multiple places. And then that night I get a phone call, please, come to UCLA urology. The head of urology is going to meet you at 5:30 p.m. And I was like, what? He's leaving a conference in the Marina Del Rey and driving up to meet you. I'm driving in, I get another phone call that I'm booked for surgery on Monday.
Wow.
And I was livid. I'm like, what's going on? How dare you? And he smiled at me, this warm smile. And he said, come to my office. And first thing he did is he got my eye level. He did not stand above me. I didn't stand. He said, have a seat. And he said, Jonathan, you won't remember everything today, but I want you to know two things. You have testicular cancer and you will survive. And I know that because I'm a testicular cancer survivor and I became a doctor to help men like you. And I was 28, I was alone, and I just started crying and he held me, literally held me. I have a 1-year-old baby, he held me like that. He wrote his cell phone number on a business card that I still have. And I said, do I need chemotherapy? Do I need this? Do I need that? My mother had cancer and I mentioned the type of chemotherapy. And he said, how do you know that? How do you know that? No, we don't know yet. We don't know. All we know is today, and we're going to do this one day at a time. And I think that's really what I would recommend to anyone listening is there's no way for you to take in the totality of this diagnosis today or how it will affect you in 10 years. In fact, that term, how do we navigate the healthcare system, is kind of a misnomer because it's not the medical system. It is how do you navigate life as a patient who has a cancer diagnosis? And maybe you don't even like to be called a patient. Maybe you're no longer a patient. I'm no longer a patient, but I still have side effects from treatment. How do I manage that 12 years later, right? So it is far beyond, as Victoria was mentioning, what are the resources out there? How do you deal with work? How do you deal with education? And that's really the tricky part. Because we could teach you what terms mean. We could teach you certain in-network, out-of-network billing, but we can't teach you all the ways that it may affect your life. And that's really why I became a board certified patient advocate, is to help people in that arena.
Great. Thank you, Jonathan. Yes, Lisa, you don't have to.
Yeah, I was.
Yeah.
Thank you. I was just struck by, in the beginning, I think just like with any relationship, you're getting to know each other. There need to be certain ground rules established. What works for you? What doesn't work for you? What do you like to be called? What, you can ask your team, what do you want? How would you like me to address you? And not every doctor, like Jonathan's doctor, will give you their cell phone number, but you have every right to know what the most efficient way is to contact you, to get questions answered. Sometimes you might not even know what to ask in the beginning. And so you might say, well, what do other patients in my similar situation, what kind of questions did they want answered? What were the questions that you felt were most important to be addressed, in the beginning? So really, again, setting those ground rules, and then, you might want to know what's going to happen today, then I want to know what's going to happen tomorrow, or you might be the kind of person that wants to know everything, right? And wants a whole timeline. So it really is about understanding what works for you and what you need, and then expressing what those needs are to your team. That includes, doctors, nurses, physicians, social workers, anybody that's going to be in your care team, just to really, get off on the right track with those expectations in the beginning.
Great. It's
or if I may, what Lisa was really talking about, I strongly encourage is your autonomy. Like, your identity is not cancer. You are not cancer. You are still Joe Smith or Jane Doe. You have an identity and you have decisions to make. And decisions in your treatment, even choosing not to have treatment, is a choice, right? That's ways we could take agency. And I really hope that you see that you may feel like a victim, like this happened to you. Why did this happen to me? But you still have decisions to make. And there's power in those decisions.
These are such wonderful points. Thank you. In fact, it reminds me of a question that came in through registration. I know people put in when they registered, if they needed, they put in a question. And a person with cancer had asked, how do I get the docs to treat us as active partners to properly educate us? So maybe being that partnership is also, if that's important to someone, does that sound like something that would be something you could address? But it was, like I said, from the audience, how to get the docs to treat us as active partners. Is there something you'd like to say about that? Maybe Dr. In, I don't know if you'd like to say something. It sounds, and to properly educate us. And I have a feeling you're good at that. That's the thing. But is there some advice you can give to people if maybe they're up against, maybe it's harder for them?
Yeah, I mean, I think it's really important that you sort of know how to communicate effectively with your provider, and that they also effectively communicate with the patient too. And figuring out what those lines of communication are is really important. As Jonathan had mentioned, nobody expects a patient to understand and know everything from the get-go, and there's so much information and so many steps that can be involved in your care throughout this whole process. So, whether it's, remembering a minor thing like when's your next, test that you have to do, or whether it's something really important like what are the pros and cons of this therapy or something like that. I think making sure you have that ability to communicate, get the answers to the questions that you need is really important. And I think we have various ways of trying to overcome those barriers. Sometimes it's for example, in my clinic, I have a nurse practitioner who is great for me to work with, but she has a very different personality than me, and we have different communication styles. And so sometimes things which I try to bring up don't get addressed, but when she has these conversations, boy, she can really get through to the patient. And and sometimes it's a navigator, or similarly, I think sometimes, and I'm so glad Victoria's here, but sometimes having a family member or even a friend, sometimes it's the person who gave the patient the ride that comes in and communicates more effectively with this. So, I think it's so critical to make sure that we really communicate in an open and transparent way, and that we make sure that everybody's kind of on the same page, because we all want the same thing, right? So I think that's very important.
Yeah, you make a really good point about not just, going to, not just the physician, but there's a whole team that you can, address. I know in terms of Liesl, you can go to your social worker or, like you said, nurse. It's a real team. So you should know that that's a resource for you. Okay, that's great. Now we talk about AYAs. Now AYAs, as we know, is a very broad age range, 15 to 39. And I'm just wondering, how do you determine? I know for people here, we have some people at Children's Hospital that certainly have more access to younger AYAs and then to the older, but what are some of the strategies? I mean, are there different strategies that work for those different groups? It's a very different, I know I worked at Children's, by the way, and of course I realized that it is so different to work with teenagers than it is to work with young adults. It was a real learning curve for me. So I don't know if you want to, talk a little bit about the differences or what you found is the best strategies, maybe for the younger and then for the older. But I know for Liesl, you actually work the broad range because you're in
Right.
survivorship.
Right. I think, again, it's sort of meeting the patient and the family where they are, right? And trying to get to know the patient family, understand how they communicate, how do they talk about difficult subjects, how have they had an experience with a serious health condition previously, and how was that talked about in the family? We really encourage open and honest communication, even with little kids, and as children get older, it's important for them to have the teaching and information about their diagnosis and how to take care of themselves in a in a way that's age appropriate. But we, really want to make sure that when we're in the exam room, that we're not only talking just to the parent or just to the child. It really is a family-centered approach. That said, as children become adolescents, we also like to make sure that we have time for teenagers, especially, to meet with their team alone, maybe without mom or dad. Maybe there are questions they want to bring up or sensitive subjects that they might feel embarrassed or ashamed, or just don't know that this is something they haven't even talked to their mom or dad about. But it's really important, and what Jonathan said about the autonomy and giving that patient that power and that space to really be direct with asking questions, getting answers. We always encourage, multiple ways of getting information. There's the oral communication, there's maybe going on the portal and reading medical records. There's, again, consulting with different members of the team to get sort of a different take on how to address this particular treatment or situation. So really, just I think in the pediatric and adolescent space, it's a lot of modeling, a lot of teaching, a lot of supporting, and then also helping and supporting parents know that they're going to need to at some point step back a little bit. And so, just like, we teach our kids how to tie their shoes and brush their teeth, we need to teach kids healthy lifestyle behaviors and how to, take medicine, how to make an appointment, how to navigate insurance. So just like kids learn in school, sometimes I think, in the healthcare system and the healthcare setting, there's a lot of education and teaching that goes on in this population.
Right. And Liesl, kind of connected to that is that, and I was thinking Liesl and maybe Dr. In, because Dr. In, you work with a lot of young people young adults that are on treatment. It's of course the whole spectrum, but you do see them on treatment. And Liesl works with survivors. I'm just wondering if there's differences in communicating when you're a survivor versus as someone newly diagnosed, because are there kind of different important ways to communicate with, those new versus those off of treatment? And I don't know if there's an answer to that, right?
Yeah, I think just like Liesl said, it's about trying to meet them where they are. And for, I think, every patient or every person who's going through this, it's a journey, and it has different time points. And so, yeah, I think our conversations are very different. I try to be, I think it's very important to be supportive throughout the entire thing. But at the beginning, for sure, I think we have a really important role in making sure that, a patient understands what to expect, how we view the process, what our goals are, what our expectations on. And I also, just try to really make sure that they understand that, at some time points throughout this whole process, we may have to reassess. Maybe the path pivots and takes, I tell people sometimes there are bumps in the road. It's not always a straightforward thing, but as long as we're still moving in that same overall direction, it's really important for us to try to make sure that they have context from our perspective too, from the healthcare team's perspective. I think Jonathan and maybe Victoria can tell you too, survivorship is no small thing either, actually. So yeah, I think we do definitely have to provide context around each of those phases. So, for some people, maybe more information is needed. For some people, maybe less. And, maybe it's just about, I think being there for them to make sure they get through each step. I tell them, hey, just keep your head facing forward at all times. I think that's important, though.
Or could I jump in? Something that Dr. In said, that treatment and survivorship, for that matter, is not linear. I could guarantee you there is something that you going to happen that you didn't expect. And if you could go into it in a place of acceptance, knowing that it's not going to work like you wanted, that there is going to be a time when you're like, I want to hit my head against the wall. And, the average oncologist spends roughly, unfortunately, they're so busy, around 15 minutes with a patient. Like, could you imagine diagnosis, everything you need to know, see you in a bit, 15 minutes on to the next one. So when you do get time with your oncologist, I think it's important, how do we maximize that, right? And one trick that I've learned that you can do, the people who know the most about and I'll say this with like an asterisk, that knows the most about your type of cancer is people who've been through it. They will give you inside points that I couldn't imagine. Like a platinum-based chemotherapy, like cisplatin, leaves a metal taste in your mouth. And if you use lemon heads, apparently that gets it out. Like the only people who've been through that, Dr. N smiles, feel free to use that tip to any patient you give a platinum-based chemotherapy.
No wonder we have boxes of lemon heads in our room, in our AYA office. That's interesting.
So I've been told. I didn't have it. I had surgery instead. So what I'm saying, a great resource is Immerman's Angels. So regardless of your age, you can go on there and get matched in your neighborhood of someone who had the same type of cancer. And the reason I said an asterisk next to it is you may have a very similar, but there's subtypes of cancers based on your genetic profile that you may be slightly different. And what worked for them in treatment and so nuanced may be different than what works for you. So that's why I say we have to be cautious. And there's also the human element. There are certain types of cancer where there are options for treatment, and you have to decide what's best for you as a person. But I think it's a great place to start so you can maximize your time with your doctor and ask your doctor the relevant questions. Going to Dr. N because you have nerve pain, he's going to refer you to someone else, and just knowing who to speak to when you need to.
Interesting point. Thank you. I'd like to move to something a little bit more specific, and that's and I think we touched upon it already, but sensitive issues. And there are so many sensitive issues that are particularly sensitive for AYAs. Like infertility risks, sexual health and problems that may arise, risky behavior and impulsive decision-making are just amongst some. Adherence to treatment, I know, is a big one, especially at Children's. I don't know about USC, but I know certainly at Children's that was a big issue. So I'm just wondering, how do you as professionals deal with it? And also as you both, I guess, Victoria, I wanted to know maybe from your point of view, how do you deal with kind of just even sharing those honest feelings with your provider? Is it difficult? Would something make it a little easier? So I'm just throwing it out there, and anyone can jump in. So please.
Yeah, absolutely. That's a great point. Me and Mars have definitely had open, honest conversations about that. And when you want to have an honest conversation with your caregiver, definitely just keep the terms professional, keep them medical. Don't be afraid to ask questions. I wasn't really afraid. Of course, it would be wonderful to have children one day. We do have sperm frozen for the future. So that is one way to preserve. And then I'm healthy. I like to think I am. And like I said, just keeping terms professional, keeping that open line of communication with your partner open, and just hopefully get resources and really just advocate for yourself. And don't be afraid to ask questions, even if you are a little uncomfortable. Maybe you can write it down. You can email it. It's totally up to you if you're uncomfortable with that line of category. It's definitely something that has to be talked about, and I'm just really glad that we have had so many conversations.
Mm-hmm. Great, thank you.
I think sort of piggybacking on that, I think, as we know, cancer does not happen in a vacuum, right? We have young people that are growing, developing, trying new things, curious about all kinds of behaviors and things like that. And I think really the most important thing is developing that two-way trust. You can trust your team, and they also need to trust you. So that's why the honesty, even if it's something embarrassing or that you probably shouldn't be doing or doing as much of, I think that open communication is so important, especially when we're talking about maybe certain substances that are being used. You know, what would it mean if I'm receiving chemotherapy and I get pregnant, right? Or can I be on birth control and go through chemotherapy at the same time? So, you know, can I go to class? Am I gonna be more at risk because of my immune system? So all those things that impact life outside of the exam room and outside of the treatment experience, you know, that's the whole person that I think is so important to remember. The providers need to remember, but also the patients. It's okay to bring up just about anything because cancer affects so much of our lives, but it's not the only thing going on.
I just want everyone, thank you, Liesl. I want everyone to know that Kathy just told me there are some questions on our chat, our question and answer things that, and they look really, really important. So I'd like to make sure we get them in there. Let me ask the first one, and then I think there are 3 or 4. So, do patients who are more experienced in their cancer journey, or who are no cancer patients, but instead cancer survivors, okay, have a role in the ongoing journey of other cancer patients who have just begun their journey? And I think you kind of touched on that, Jonathan, through of the program. I mean, certainly our program at Norris has that as you know, kind of has both the survivors and those on treatment working together, but you know, meeting each other. But does anybody want to answer that? Do patients who are more experienced in the
I
cancer?
think Jonathan answered that earlier, and I think Jonathan himself is a perfect example
Mhm.
of how much a survivor can really help others.
Mhm.
Well, my ego says thank you, but that's not why we're here. I think what's unique about AYAs, and it kind of gets the power differential as well. If you are older, even if you did not have a cancer diagnosis, by chance, like Aura, you've never had cancer, have you? To my knowledge, you haven't, right? But you've had other medical conditions in your life. I'm guessing you don't need to share, but you've been to the doctors probably more so than a healthy 21-year-old who didn't know they had cancer until they were told they had cancer. You know, like if someone has like, it feels like a cold, you may think, I feel like I have bronchitis, or I feel like I have an infection. You know, like I've fled, right? But no, cancer doesn't feel anything. So you don't feel until you're told you have cancer. And then it's like, I should have known. I should have known all those signs. So it is not fair of patients to say, like, should I have had this more experience? You just get better at it. You know, think about anything you've done. The more times you go to the batting cages, the more times you're going to hit the ball, right? It's just how it works. The more times you go to the doctor, the more times you're going to get used to receiving good news and receiving bad news and being pissed off and being upset that your life and trajectory has changed. You're going to know where to go for resources. You're going to know which friends, which family members you could turn to, and for that matter, which ones you can't. Because I had family members who just were emotionally unavailable. Mm-hmm. Not that they didn't love me, but they just weren't in my area or didn't know what to do. So I hope that answers your question, and if it doesn't, I'm happy to put my email in the chat and we can talk later.
That's great. Yeah, this is it was an anonymous attendee, so we'll figure that out. But anyway, then there's another one. I'm a case manager. So this is someone who's in the field trying to help a woman just diagnosed with pancreatic cancer. It doesn't seem like there's really is a coordinated team for her. And the oncologist is nice, but very hard to get to talk to, not a friendly or knowledgeable receptionist in his office. And her daughter, I'm sorry, this is a long question, 17, is the primary caregiver and gets confused. Of course, that's what we talked about, being confused with all the information to handle. She did get caregivers from her health plan to help, but how do you put together a team when it's just not coordinated? That's a great question.
Yeah, it depends on where that daughter is located. I'd like to give her my information as well if she would like some help with that. If she's in the state of California, definitely advise her to look into in-home support services. It's like, I'm pretty sure it's something with health services, and she could interview a couple of people, and then she could get some help with cooking and cleaning. And then EBT, I think you just need like either her mom's past income, and then maybe an ID, and then the social, and you can apply for EBT and get that resource. And as far as like trying to put together a team that's not coordinated, that I hope that they can somehow work together, but I'll put in my information as well, because as a 17-year-old, that's a lot to put on a young girl. And I really hope that if she needs help, she can reach out, and hopefully we can get her some help.
That's great. Thanks, Victoria. Does anybody else have anything that they want to add to that? Because, you know, how to put together a team when you don't have one, I guess, is what she's really saying.
I think the question would be, what is the need? It sounds like they have a medical oncologist, but is further therapies needed? A surgical oncologist? Is radiation needed? Is pain management needed? Because this whole idea of a multidisciplinary care team is all these people working together. So I think best advice is to understand what the need is, and empower the patients with the information so they can make easy, informed decisions. Like put it on a silver platter for them. Like all you need to do is call this number. They're expecting you. That level of easiness. But what do you think, Lisa?
I think, you know, trying to stay as organized as possible, you know, write down your questions, write down the answer to the question, ask the doctor we think of sort of like an orchestra analogy, right? The doctor is sort of the conductor, and then we'll call in the instruments or the other interdisciplinary team or members to help with certain aspects of care, whether it's discharge planning, home care, the psychological health issues, the logistics, you know, food, clothing, and shelter, social work maybe, and maybe there's a specialist. You know, most centers have what's called a patient navigator that can help sort of bring all that together, especially if the oncologist is short on time. But I do think that doctor is the person to ask, who else can we bring in to support? You know, this is, and trying to really think hard on what those needs are. And again, if you don't know, what do other patients in my mother's situation, what have they needed? What have they benefited from? I've never been through this, so I may not even know what to ask, but what are other patients in a similar experience? What have they needed? And what have you recommended? And then of course you know, cancer support community has a helpline, cancer care has a helpline, LLS Society. So beyond the treatment team, there are external resources that can at least help guide you about how to get those questions and those needs met at your team, at your location.
I just want to say I'm sorry, because I believe when I answered, like I sent my information to somebody, it closed the question, but it's still under there.
Okay, thank you. Thank you. We'll figure that out. Okay, Victoria, that's great. Also, in fact, then someone did say, thank you for sharing your experience, Victoria. So someone actually wanted to thank you personally and being here to represent Mars for this amazing and informative webinar. So someone's really thanking you a lot. Support is so essential during the difficulties that come with the cancer diagnosis. How much has mental health and mental health support helped Mars and yourself as it relates to his wellness and progress? So it's bringing up a really good point about mental health.
Yes, thank you, Angela. I haven't really looked into mental health support, as my outlet is working out, running. It's been a really good outlet. Unfortunately, though, like when I was working out recently, Saturday, I took a hard fall and I skinned my knee, so I'm actually out for a few days. Yeah, it was bad. But as far as mental health for Mars, his outlet is video games. So I think it would be beneficial for us to maybe look into more mental health support if needed. And I believe that I know that USC does have those services. And then as far as me, if I need mental health support services, I'm not exactly sure how to access them. So maybe that would be another conversation for later. Not just for me, but for him as well. Like, how exactly do we gain those connections to mental health? I'm pretty sure he has them, but we just haven't really felt the need for them just because we have some outlets, we have our dogs. So it really depends on also whoever is in this webinar, it depends on you. What is your outlet? How do you cope? And it's it's kind of interesting because I guess we were offered, but it's not spotlighted, if that makes sense. And I hope, if you have an outlet, that you use it.
So everybody's we kind of talked about it earlier, how everybody's individual and each person has a different need. But I guess there was a follow-up question about, is there adequate mental health out there? And no. So
Like
that's
cancer, there's no way hearing the words "you have cancer," someone you love, you have cancer, and it doesn't affect your mental well-being.
Exactly.
I treated at UCLA, and the Sims Man Center had free cancer counseling, and man, they should have charged me rent. I lived there, so I was there so much. Like, just roll up, let me sleep on the couch, and it made the biggest difference in the world. And you may be saying, well, my cancer center doesn't have that. How does that help? So one thing you could do is, if you log into, whether you have insurance through privately, through the state, through family, log in, and it's underneath, it's not medical, it's behavioral health or mental health. Find a provider, and then there should be a drop down that says cancer care or cancer experience, and that will help you find a therapist in your area that has experience with cancer. I don't want, if you find that the diagnosis or treatment has been traumatic, then you may want to speak to someone who has experience in trauma. And in my own experience, I did something called EMDR therapy, where I was able to be exposed to this negative idea that I had cancer, and this idea that cancer will be back tomorrow. Like, I'm gonna have cancer no matter what. And we were able to work through it. It was amazing. So yes, please seek mental health care if you feel like you need it. I'm a strong supporter.
Oh, okay. I did not know that. Wow. I don't exactly know if there is adequate mental health support for patient caregivers. As far as myself, I haven't really been offered mental health support. Like I said, different outlets. I meditate, I journal, I work out. That's been helping. And then for family, my mother-in-law, I believe just most of our outlet is cooking. I'm not entirely sure what she does for her mental health, but I do know, like we said, we have that open, honest conversation because we're a team. We need to be on the same page about that. And definitely think that I'm not entirely sure if there is adequate mental health for at least caregivers. I know for patients, I believe it's been offered at least. I'm not exactly sure how easy it is to access it. I think it would be great to have kind of a therapist or a mental health support for cancer and for caregivers. That would be very beneficial.
I thought I'd just add that Deborah Winsky does say thank you. I think she really appreciates everybody's input here, so thank you. And I know it's getting, well, it's 12:57. We may have room for one more. There were really good questions, and I know I didn't get to all my questions. And Jonathan, I think you're telling what, all the information you gave us today really kind of explain what a role is, what that role is that you have as a patient advocate. But did you want to add anything? Because that's kind of an interesting, this whole certification, being a patient advocate is relatively new, right? It's a new kind of role and a new kind of career.
Yeah, so the board certified process has been around since 2018. I have to upkeep it every 3 years with further training, attending conferences, but there's still, with as good as our medical system is, there's still holes. Even though that a doctor may write a referral or the nurse navigator may say, go see this, but there's so much onus and responsibilities on the patient. And there's a lot that we do, but one thing we kind of glossed over that I wanted to mention was power differential.
That's right.
And how intimidating. I mean, look at Dr. In. He's handsome, right? He's intimidating with that lab coat, and it has these cool patches on it. He looks like he belongs, like but that smile is warm, right? It's this duality. So how do we feel comfortable enough to have those honest conversations? And like, what are things we could do? Obviously we mentioned, how could we talk to you? Could we call you Dr. In? Could we call you Gino? Could you call me Jonathan? Could you sit on my eye level? Could you come in with these questions already prepared? How could you be your authentic self? Because think about your own experience as a patient or caregiver. Think about the person you present to be, And then think about the person when you go home and tell your experience about. Like, how do we get those two worlds to come together? And that's how patient advocates help, is neutralizing the difference. And I hope that answers some of it.
Great. Well, thank you. I know, and I wanted to get to that question about power differential, but I'm so glad you brought it in. Thank you. And it is 12:59. I just wanted to, just kind of as a kind of the last thing to summarize, or kind of the final comments. I don't know if anybody has anything final, but a key word maybe, or something about how communication is so important. I mean, you guys all touched about how important it is, and how important it is not only for relationships, like Victoria said, not just for the caregiver, but the whole family, for everyone on the team. It's just like a very, and to foster meaningful conversation is something you all address. It is time to say goodbye. I would like you to say a word or two, but if you want to, I'm going to give you an opportunity to say something really quickly. But it is 1 o'clock, so maybe it's time for me to just say thank you. I think, unless there's something burning you want to say.
I would just say there should be an expectation and a right to have effective communication
Okay.
between patient, physician, family, team members, and then the physicians and the other team members to communicate together on a regular basis.
Right.
It's an expectation, and it's a patient's right to have effective communication.
And you're not a bad patient. This idea that you'll be bad and a doctor will withhold treatment from you, get that out of your head. You're not bad by speaking up for yourself. You're being loving of yourself.
I 100% agree. And as a physician, we really do want you to come to us. And, I thought it was a great tip to maybe write down what are your priorities and your big questions. But if you come to us, advocate for yourself. That is so important. And if you think something really is a priority, we do want to know these things, because we want what's best for you too. And man, we all want the same thing, right? So it's good for us to be on the same page. So don't be intimidated. Please.
Thank you, everybody.
And as a caregiver is not your entire identity. Remember that you matter, and that your mental health matters, and that you're just as important in this journey as the patient.
Thank you so much, Victoria, and thank you, everybody. And Kathy, I don't know if you want to say a word or two, but thank you very much, everyone, the panel, for being here.
Yeah, I want to express my thanks to you, Aura, for leading us through this time. And I'm looking at each of my tiles, and on behalf of Cancer Support Community Los Angeles, to thank each of you for sharing your expertise today, your time, and your personal experience. I mean, everyone here shared their personal experience, whether that was from the perspective of your own story or as a healthcare provider. We have learned so much from each of you, and really appreciate you giving of yourself today. I want to thank our attendees. You've been wonderful. You participated, asked some lovely questions. And I think as we go out, Abby, we have, I think, a slide from CSCLA and one from the Adolescent Young Adult Program. We're going to get those up. Cancer Support Community Los Angeles, I know there was some discussion of mental health support, caregiver support. So just as a plug for our programs, we do offer brief individual counseling, and that's at no cost. So if you're having difficulty locating support that's right for you, reach out to us. We have a variety of support groups, including several for young adults. We have a young adult caregiver support group. So if you have any questions about that, or have interest in participating in one of those support groups, you can email us at info@cancersupportla.org. And then we put a flyer up for just a fun thing that we do every other month. It's our young adult game night. Our next one is June 25th. So you are welcome to join us for that as well. And then Aura, I think I'm passing things off to you for our final slide.
And I think you made, Kathy, thank you, because you described the program very well at the beginning. So I probably don't have to say much, but if you want to know about any of the programs we have a lot of things, kind of fun community building programs like our 3-day retreat. Please take down the information that you see on this slide and we'll tell you more about it. And we can put you on our newsletter and that will keep you posted on what we do every month. So thank you very much. And I just want to say one more thing that I was looking at the Q&A and there's so many thank yous to all of you. So everybody appreciated everything you did today. Thank you.
Thank you.
All right. Thank you, everyone. And we will see you in the future
Yes.
at another webinar. Take care.
Thank
Bye.
you.